Here, I tell you what, I'm gonna skip ahead just a little bit. Here, let's do this one.
What is the best EMT level action?
Okay.
Two-step.
All right, let's go.
I don't know what they'd be doing. 2-year-old has a barking cough,
Okay.
low-grade fever.
When do I think of that? What condition do I think of this?
CCED.
Okay, and what's that? Like what condition would have the cough?
That'd be that's like a
So one condition has drooling, one condition has a cough. Which is the one with the cough?
Croup.
That's going to be croup, also known as
laryngotracheobronchitis.
Laryngotracheobronchiolitis. Okay, cool. I like it. And viral or bacterial infection?
Viral.
Primarily viral, sudden onset or gradual onset?
Gradual.
Primarily gradual onset. What's the number one virus? It's going to be parainfluenza virus, or often it can be respiratory syncytial virus, okay, or other viral infections, but these are probably the most common, okay? What am I going to do for this croupy patient?
give them oxygen.
Okay, now we may give humidified oxygen or take them outside in the cool, moist environment. The biggest thing is to keep this patient as calm as possible, though. So in this case, we're actually just going to go with A. Now, one thing, especially at the paramedic level, based on your protocols, one additional thing that you may do is we may end up having to give this patient some kind of steroid like dexamethasone, so Decadron or something like that. Okay, that's what we're going to do for this one. All right, so Maris, you ready to come in?
Sure, I'll give it a shot.